Welcome to Tees Voices, telling the stories of the people in our NHS community.
So welcome to today's show. We're talking about something really interesting that's shaping healthcare right across Teesside, parts of North Yorkshire and parts of County Durham. It's the new University Hospital Tees strategy, Caring Better Together.
That's right, and joining us are two people right at the heart of it, Becky and Dawn, the two strategy programme managers from the strategy programme team. Welcome both.
Thanks so much. It's great to be here.
Yeah, lovely to join you. We've been looking forward to this.
So let's start with a bit about you both. What does the strategy programme team actually do?
So our team helps turn those big strategic ideas into real practical change, and we work with teams right across the University Hospital Tees. So we help them plan, we help them deliver, and make sure that everything links back to that bigger vision.
Exactly. We're like the bridge between the ambition and the actual action. We give colleagues the support and confidence to try to make that strategy real, so it's not just a paper exercise or something written down on paper.
So let's start with the why. What's driving the need for this new strategy?
So our population's health needs are changing and fast as well. We care for around about 700,000 people locally and almost 1.9 million across the wider region. The issue is there are big differences in our population health outcomes. If we take a couple of examples, for example, in 2020, the national average life expectancy was 82.6 years for females and 78.6 years for males. Across 4 of our local authorities, the average difference in life expectancy was 2.25 years shorter for females and 2.85 years shorter for males when compared to that national average.
And also, the number of people living with limiting long-term illnesses is higher in all the local authority areas in our UHT footprint than the national average. So the national average is 17.6%. And if we look at Stockton-on-Tees, for example, that's 19%. In Middlesbrough, it's 20.9%. In Redcar and Cleveland, it's up to 22.8%. In Hartlepool, 23.2%. And of course, we know we cover some parts of North Yorkshire, but even there, it's 18.8%. So we're higher in all of our areas across the board. And similarly, if we look at the emergency hospital admissions for adults in the UHT footprint, we're well above the national average there as well. So in Stockton, we're a staggering 29.8% higher. In Middlesbrough, again, a huge 32.1% higher. In Redcar and Cleveland, 10% higher. In Hartlepool, 33.5% higher. So again, really big numbers here when we're comparing. It's absolutely huge, and we can't close that gap by doing things the same way. We have to focus on prevention, we have to focus on earlier support and that care closer to home.
I mean, wow, that is really powerful. But I guess there must be pressures inside the system too.
Definitely. So people are living longer and often with much more complex conditions. The buildings that we work out of are ageing, and recruiting our skilled staff can be really tough. We need to stop and think a bit smarter about how we deliver care and how we support our workforce, and also how we ensure as an employer we're a destination of choice for people's careers. We want to be able to attract talent and keep those people who are in long-term roles.
And that's why last year the two trusts, North Tees and Hartlepool and South Tees, came together as the University Hospital Tees. And it's a huge opportunity to work at scale, to share our expertise and make care more consistent across our region.
So this isn't just about challenges then. Is it about opportunities too?
Absolutely. So it's a chance to create something stronger and more sustainable, which is truly focused on what our communities need for their future.
So tell us then, what's actually in the strategy?
So our vision's really simple: caring better together to continuously improve the lives and well-being of the communities we serve. And that's what drives everything that we do. And it's built around these 3 pillars. So we have patients and population, so making sure people get the right care in the right place at the right time. We have our people pillar, so supporting our colleagues and making University Hospital Tees a great place to work. And then we have partnership in places, so that's working with our partners from councils to universities to make a bigger difference together.
It sounds really values-based too.
It is. So we asked over 6,000 of our colleagues what mattered most to them, and that shaped our values, so respect, support and collaborate, and they guide how we treat each other, but also how we treat our patients and our communities.
And those values show up in some of the work that we're doing. So if we take hospital at home, for example, the hospital at home programme is hospital level care that enables patients to recover safely in their own homes. It's right care in the right place at the right time. It's specialised care in a patient's own home, and it can be for a range of different conditions, which reduces unnecessarily hospital admissions as well as enabling those patients to go home from hospital sooner.
And we're also expanding our elective surgical hubs in Hartlepool and North Allerton. So these hubs let planned surgeries go ahead without being disrupted by the emergency pressures. So that means fewer cancellations, faster recovery, and a better experience for everyone, staff and patients alike.
And we're exploring the art of the possible within digital transformation as well, so moving from that analogue to digital, as indicated, particularly from the 10-year plan. For example, we know that we use multiple different electronic patient record systems across our two organisations, and a big piece of work is underway to map this and look at streamlining different options for the future.
Oh, I love hearing all this. It definitely sounds like working smarter and not harder.
Yeah, exactly. So it's about transforming how we work, not just doing more of the same.
So how can people get involved in shaping all of this?
To be honest, there's loads of different ways. We'll be holding engagement events, things like drop-ins, workshops, different online sessions, and these are all designed so people can get involved in whatever way works best for them.
And we want to hear everyone's voices, staff, patients, partners, local communities. This isn't something written for people, it's something we're building with people.
That's such a great message, so powerful. So it's about co-creation, not consultation.
Exactly. So caring better together is about shaping the future side by side. We're listening, we're learning, and we're working together.
And as well, even after the main engagement events, there'll be lots of ongoing ways to stay involved. We'll be sharing updates, we're doing some podcasts and different opportunities so staff can feel that they can contribute ideas as the strategy becomes embedded.
Because ultimately, the future of university hospital teas is going to depend on all of us. So every idea, every story, every bit of feedback helps us build something stronger, for our patients, for our people and for our places.
So if we fast forward 5 years, what do you hope we'll be saying about university hospital teas then?
I'd love people to say that we've really made healthcare feel more joined up, that really no matter where you live, you can access great care from people who actually love what they do, and that our staff feel proud, supported and valued.
And for me, it's about pride and belonging, so that we've created that organisation where colleagues feel inspired to innovate and where teamwork can truly thrive. And I hope we'll be able to say that we've not just built better services, but stronger communities as well.
That's such an uplifting vision, and it feels quite achievable, and the passion that you both have gives me confidence that you're really going to run with it.
Thank you. And honestly, that's what Caring Better Together is all about. We believe it's not just a slogan, it's more of a mindset, and it's one that starts with each of us choosing to make things better together.
That's a brilliant note to finish this podcast on. Dawn and Becky, thank you so much for coming in and telling us all about the strategy. I'm really excited to look forward to what you can develop in the future.
Thanks for having us. It's been great to chat.
Yeah, thanks so much, and we can't wait to see everyone at the engagement sessions.
And that's all for today's episode of Caring Better Together. Keep an eye out for details on how you can get involved, because the future of healthcare here in our region, it really does start with all of us.
Thank you for joining us. Till next time, you've been listening to Tees Voices.